Good afternoon, this is Dr. B, and the question I want to answer today is, what are buprenorphine withdrawals like? Just for those of you that are unclear, buprenorphine, you can think of that as the same thing as Subutex, you can think of it as the same thing as Suboxone, or any of the other formulations that are out there put out by different manufacturers. We'll just call it buprenorphine. What are buprenorphine withdrawals like? I'd like to take this opportunity to answer to that question is really simple, and I just want to take this opportunity to ask the right question. The answer to what are buprenorphine withdrawals like is that it is a partial opiate, and the withdrawals are like withdrawals of any opiates. If you're on a large dose, or I take that back, if you're on a dose that is prescribed, that is the normal dose for opiate addiction, let's say 16 milligrams, 24 milligrams, all of the withdrawal symptoms you have somewhere on the spectrum, if you just suddenly stop, depending on how long you've been on it, are going to be the same type of withdrawals as opiates. Anxiety, sweating, diarrhea, abdominal cramps, a feeling of severe restlessness, body aches, all of the same symptoms as withdrawing off of any opiates. The reason I'm bothered by this question is that there's so much misinformation out there, and there's so much handling of all of these medications out there, and some of it is being diverted and sold on the street, and there's so much self-management out there. The real question is, how do I come off of buprenorphine? What are the circumstances I come off of buprenorphine? How long should it take to come off of buprenorphine? Before getting into that, let me address one thing. The studies show this. Buprenorphine, getting off of it, takes a lot quicker in terms of withdrawals than methadone, and the withdrawal symptoms are a lot shorter than they would be coming off of heroin. So all of this information on the internet that says, oh my God, this stuff is a nightmare to get off of, it's worse than heroin, it's worse than this and that, that's all false. The studies show very clearly, I will repeat, coming off of this medication, the withdrawals are less severe than heroin and last less amount of time than coming off of methadone. That being said, as you can see, it's a very easy answer. But what really concerns me, and I want to use this time, is to tell you that the question is wrong. Why are people asking this question? Let me give you an analogy to start that discussion. Insulin is a life-saving medication. And if you take your insulin correctly and you're on it for your lifetime, you will pretty much have a very long, healthy life for the most part. That being said, if insulin was being traded on the streets, you would see a lot of deaths from hypoglycemia, low sugar, because people are trading and using insulin on their own. If blood thinner was being traded on the street, a medication that prevents so much death, if it was being traded on the street, you would see a lot of deaths because people can't manage the dosing correctly, and they would bleed to death because they would take too much. And if they take too little, they would have all of the other complications that you're taking this medication for in the first place to prevent. Suboxone, buprenorphine, Subutex, Zubsolv, none of these medications work any differently than insulin or the blood thinners out there. You should, number one, it's illegal. You can't be trading this stuff on the street. You shouldn't get this medication, pick your own dosing, and decide your own detox with this medication. It just doesn't work. And when you have a lot of people on the streets using this medication to stay well, get well, attempt to get well, they can't get heroin that particular day, they use it as a commodity to make money, pick days that they want to be high, pick days that they want to be clean. When you're using it in this way, also a natural outcome of that is they get off it the wrong way, and there's a whole bunch of stuff being put out that is incorrect, and that is, this stuff is very difficult to get off of and horrible withdrawals. Well, you're not on it, you weren't put on it the right way, you're not on it the right way and you're getting off of it the right way. So number one, you need to be under the care of a physician who not just prescribes this stuff and sends you off and says, okay, you're on it, but very closely monitors you, manages you, addresses any psychosocial issues that you may have on this medication, and assures that you stay on the right dose for the right amount of time. Once you're on this medication, when should you get off of it, and when would you get off of it? Well, there's no real data of when, and there's no real data of how. What there is clinical experience and judgment of an experienced clinician. That's important. And with that clinician, the first question is, well, why are you coming off of it? If you've been on heroin, now you're on Subutex, and you're not overdosing, you're not getting hepatitis C, you're not getting hepatitis B, you're not getting HIV, you're not getting soft tissue infections, you're not getting infections in your heart, water in your lungs, overdosing, dying, being put in prison, prostitution, and all of the other host of social maladaptive events that occur when you're on heroin. The question is, if you're on Subutex and you're on the right dose and life is going well, why should you get off of it? And when that time comes, how should you get off of it? And that's going to depend if it's the right time, which you need to make that decision with your physician. And he needs to start a very appropriate, individual tailored taper off of this medication that's going to depend on your state of mind, state of life, state of health, and how long you've been on it. It's very difficult to give you specifics because that would be essentially tantamount to giving somebody medical advice, and there is no protocoled way to do this. Your physician should first put you on it, bring you up to the right dose, maintain you on it, and when that time comes, whether it's 6 months or 6 years, where there's a decision for you to come off of it, he should tailor a taper that is easiest and most, or rather least painless for you to come off of it. And in those cases, I will say that there really shouldn't be any problems with withdrawal symptoms coming off of buprenorphine that are significant enough to even write home about. I do this all the time. Different patients meet different criteria, different standards, different times in their lives, and we can speed up and slow down the taper according to their physical needs, psychosocial needs, financial needs, court needs, family needs. But I always advise them what I think in terms of, is it time to come off of this medication or is it not? Other than that, if this was the way it was being done in the first place, there would be no question about buprenorphine withdrawals. And the reason there's a question about buprenorphine withdrawals, I think, A, there's so much diversion and use on the street and personal management by addicts, and that's going to be a disaster because you need a professional to help you manage this medication. B, there could be practitioners out there, for whatever reason, they have gotten caught up on this social discourse of you need to get off of this medication as soon as possible, or they do a short detox using this medication, which I feel that is really inappropriate, and I don't think there's any good data validating long-term or short-term outcomes if you do that. In fact, I think it increases the chance of overdose because you jump right back on heroin and you can have a possible overdose. But, you know, the first way is that there's so much exchange of this medication on the street. Two, there might be situations where the physician or the healthcare provider is not really in line, in tune, or has the know-how of how to put you on this medication, maintain you on this medication, and when the appropriate time for the patient is to come off of this medication. If you have any other questions, please click here. There's a whole host of videos on buprenorphine that I talk a lot more about it in depth and different issues with it. Two, you can always leave a comment below. I will answer any questions you may have. Number three, please don't forget to subscribe and ring the bell. That helps us out a lot. Have a wonderful day and good luck to everybody.